Sounds great. Everything should be live after this point.
Okay, great. Good morning, everyone. My name is Mary Jones. I serve as chair for the Kansas Behavioral Sciences Regulatory Board. I ask the members of the board to respond to the roll call to signify their presence at this open meeting that's being conducted remotely by conference call or other electronic medium. Dave Anderson.
Present.
Jill Flessing.
Present.
Linda Heitzman Powell.
Present.
Jim Comartin.
Present.
Jacqueline Lightcap.
Here.
Richard Nobles.
Present.
Andrea Padromo Morales.
Present.
Cynthia Schendel.
Present.
And David Stevens.
Here.
I note that the following staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Cindy Durkle. Cindy on?
Cindy is on the call, but I think she's muted and may have stepped away.
Okay. And Tyler Wadsworth.
And Tyla is available if we need her, but she's not currently on the call.
Okay, great. Tim Resner, serving as legal counsel for the board, is also present. And next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Mary. This is Dave Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the board to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment to allow sufficient time for the board to discuss all items on the agenda. Because we are conducting this public meeting remotely, I state for the record the following information. Access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the YouTube channel. And also we have a conference call line active as well. And while the meeting is conducted remotely, the requirements of KOMA are not suspended. As such, we will be conducting this meeting pursuant to the KOMA. On October 31st, 2023, we sent notice of the board meeting to all individuals who had requested notice of board meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material were posted on the board's website and are available for review today. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office or send an email to bsrb@ks.gov. A recording of the meeting is available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line. It is active. No one responded when I checked before we started, but if someone beeps over, I will let you know.
All right, thanks so much, Dave. The next item of business for us today is agenda approval. So you should have an agenda in your packet. If there aren't any changes or additions or deletions, I'll take a motion to approve.
Move to approve.
Thank you very much, Jim. Thank you, Cynthia, for the second. All those in favor say aye.
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 Any opposed, same sign. Great, thank you very much. As noted on the agenda, there's no one who has wanted to do public comment today. So we'll go to the next item of business, which are previous meeting minute approval. And we have two meetings to look at those minutes, the September 11th meeting and October 23rd meeting. And whenever someone ready, I'll take a motion on those.
I would move to approve both of the meeting minutes.
Thanks, Donna. Dave, second. All those in favor say aye.
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 Any opposed, same sign. Excellent. Dave, I'll hand it back to you for your report.
Thank you, Mary. We'll go ahead and start off with some operations updates, first including outreach. So we are continuing to broadcast board meetings and advisory committee meetings over the BSRB YouTube channel. With rare exception, we've been doing that since January of 2021. The board's out-of-town planning meeting is difficult, if not impossible to do. But otherwise, most of those meetings we broadcast, and we've received a lot of positive comments about Currently, we have about 131 board or advisory committee meetings that have been broadcasted, and those have been viewed about 5,000 times. As another note about outreach, Leslie Allen and I continue to meet with groups of students, mostly remote at this time, to talk about the licensing process and talk about disciplinary issues, just so individuals, as they're approaching becoming professionals, will be aware of that process, and it'll go a little smoother for them. And hopefully they will be able to avoid a lot of the reasons that might lead to disciplinary processes. We also give them resources in terms of what information is on the BSRB website and answer their questions, and that's going well. Also, in terms of outreach, last month we had 2 unique meetings that I just wanted to highlight for you. Back on October 17th, 2023, we held an educational forum for different individuals that work at some of the schools around Kansas that have degree programs for some of the professions that we regulate. I know that in past years, many years ago, there had been more of roundtable discussions of different individuals from schools. But as we've had a growth in programs, it seemed like it was going to work out a little bit more effectively if we invited a number of individuals to participate over Zoom. So we set that up, and it was put on by the BSRB staff, and had a really good turnout. I think we had close to about 35 or 40 different individuals from some of those schools. It was quite an endeavor to try to put that list together. We had a list that we were starting from when we did the past informational roundtables for educators, but that list had become a little outdated. So we tried to reach out to contacts from schools and get that list to grow. And so we realized we weren't able to connect with everyone, but we're hoping to use that list and build from it for future similar items. And we also thought that there's been a number of pieces of legislation that have passed over the last few years, and it was important that when we're having discussions with different groups of people that we all make sure we're on the same page about what is currently in place. And that might be a good place for us to start from in terms of knowing what the challenges are or what the goals are for certain groups. And so we had that. It was a really good conversation. We talked about some bills that passed during the 2021 session, the 2022 session, and also the 2023 session. And then we opened it up for questions and got a lot of positive feedback, and hoping to do that again at least next year, and then probably collect some more feedback, and then bring that to the board and let you know kind of what some of those discussions were. But as a first step in that process, I thought that went really, really well. The following day, we held an informational forum for employers. That was on October 18th, and that was about an hour long. Had a similar format. We talked a little bit about where the BSRB is currently in terms of the number of individuals we're licensing with different professions. We talked about some of the bills that had passed during those 3 years, and then we opened it up for questions as well. And some of the questions that were asked by the different groups of employers, we informed the board about at the October 23rd meeting, and that helped drive some of the conversation as well. To my knowledge, this is the first time we've ever had a meeting like this, specifically targeted at employers of mental health professionals, but I think it was helpful to kind of split those groups up and have one for educators and one for employers. And like with the employer forum, there was a lot of good feedback, a lot of positive comments. And so I think this would be something that we would want to continue again, and then maybe even allow more time to have more discussion about some of the different items. And so both of those were positive, and wanted to make you aware of those. And so thank you to everyone who attended those, and I'll be reaching out and following up with a few more people who attended those just to kind of keep the conversation going on those topics. In terms of updates on revenue and expenditures, so we have just passed the first quarter, or I guess the first third now of the fiscal year from July 1st through the end of October. And so through that essentially first 4 months of the fiscal year, our revenue for the agency has totaled about $338,000, based on projections that will come out to about $1 million over the course of the year. But it is hard to know one month to another how many individuals will have applied for licensure, but that's the current pace that we're at right now. In terms of our expenditures for the year are about $303,000, so fairly close to what we've brought in terms of revenue. Although I should note that with expenditures, those don't come in uniformly month to month. And so certain things like rent and other items sometimes we pay for multiple months at a time. And so, but basically revenue and expenditures look like they're about pretty even at this point so far. Our balance in the BSRB fee fund is right around $2 million. And so we have a good balance right now. Our yearly expenditures generally run around $1 million. So we have currently about 2 years of expenditures in the fee fund right now. In terms of some other updates, information technology. So I've kept you all informed that we've been in a process of replacing some of our aging technology here in the office. When I first started about 3 years ago, we had put in place a plan to replace some of our desktop computers with new laptops under the state's desktop as a service plan. And we replaced about a third of them the first year, and then more last year. And then this year, we're replacing the rest of the remaining ones that still need to be replaced on a cycle. And so we have new computers for staff members, and overall, I think there have been positive comments. There's always some adjustment when you have new technology, but I think this will be good. Some things I have received some feedback that are definitely running more quickly. So I want to thank the representatives from the Office of Information Technology Services. OITS does provide computer services for the BSRB, and their staff members have been very responsive, and I appreciate all the work that they've done coming here and helping staff members get all that set up. In terms of some staffing updates, I do want to let you know we are currently fully staffed at 11.5 FTE positions. We recently added 2 new members of our staff, and that had to do in large part with the bill that passed this spring, in which we got authority to hire 2 new licensing specialists for the BSRB. When we opened that process up, we did make internal hires, which opened up other spots. And so there was a fair amount of interviews and writing of descriptions to be advertised. And so that process now is complete. We have staff members learning new responsibilities. And so I think temporarily we may have just some struggles that are normal that we're working through just because of individuals learning new roles. And then based on the size of our office, some of the work that is done when someone's learning a new position is staff members are training other staff members, which will take time away from their current responsibilities, but that's the best way that we can transfer some of that institutional knowledge. So, but people are picking things up quickly, receiving a lot of good comments from staff, and looking forward to them continuing to grow and develop professionally in that. In terms of a personal note, just to kind of communicate back in terms of my role and my responsibilities, I'm very pleased with where we are as an agency. We're growing in a lot of different ways. But with growth, there's going to be some changes. So I just want to communicate with you that I think in the near future, I'll probably be transferring some of the more day-to-day responsibilities to some other staff members. I know it's a part of leadership in any organization, but I think in the way that we're growing, we continue to see the number of licensees and other items with all the different association meetings and everything else. I think this is something we'll have to make sort of a concerted effort to kind of move some of those items to other staff members. And it's become apparent to me that I could benefit from having someone function more of like an assistant to me. I know Leslie has a number of different roles and her responsibilities, but that takes up a lot of her time managing most of the licensing staff and clerical staff. But in terms of just the day-to-day items that I'm getting, I think I could benefit from that too. There is money in the budget for temporary staffing and otherwise, but I think I'll be looking to see is there ways that we can maybe change some of the responsibilities of existing staff or supplement that with individuals taking on some of those responsibilities, because it is important to me that I get back to people in a timely manner. It's just things are growing and those responsibilities are growing as well. So just want to communicate that to you. I know some of you are used to hearing from me, and feel free to contact me with anything, but there may be instances in the future to where I have someone take care of something. So I just didn't want there to be any misunderstanding, but I would address it today and just kind of let you know what my plan is here in the near future. In terms of other operations updates, one item I've been talking to you about for the last few months, we do have new board chairs, physical chairs in the boardroom. We've been working on that for a little while. Kansas Correctional Industries provided those. There is an item here under the state. When you do get new furniture, you have to offer that contract to the correctional industries. And so we did that according to the policy, and we've been waiting to receive those. So those are in place for the next hybrid meeting that we have. You'll be able to see the new furniture that we have. Additionally, I've been talking a little bit this year about our efforts to go ahead and clear paper records from our office. And our staff has done a tremendous amount of work making sure that we can prepare to move those records. We received authority based on a request in September for us to change our document retention schedule We currently hold all licensing files until the license expired, plus it had been plus 10 years, and we were able to put in a request to shorten that to until expiration plus 2 years, and that did free up about 8 years of records. And so we went through those records, cleaned them up, got them to a place to where they are ready to be transferred. But based on the overwhelming number of paper records we have here, it was going to take about 100 boxes for us to transfer those to the Historical Society. We made a request for 100. We received about 20 to 30. And so we are still having multiple file cabinets full of paper records that we're ready to transfer. And we're trying to explore some different options to maybe purchase some of the boxes ourselves, just because it would be helpful, even if we can get those that way, to be able to move the paper records, to clear the space. That will be able to put more staff members in place. So just some of the day-to-day logistics I thought I'd make you aware of in case you stop by the office and you see people in strange places. We are working on it, but there's a lot of different puzzle pieces that are being shuffled right now. In terms of some other items, under legislative updates, I wanted to give you an update on the implementation of Senate Bill 131. I talked a little bit about the staffing and the roles of those people according to that bill. In terms of the other items, we have a number of new licenses that we are issuing following the passage of that bill, and that is going pretty well. We have a couple of questions that were brought to the agency recently, and you're going to see those on the agenda a little bit later on in terms of some direction from you as board members and how we should interpret certain rules. But I also wanted to let you know too, one item that I hope to move on, but it may not be until next year, is I would like to reach out to some of the individuals who have previously been licensed by the BSRB, who have let their licenses expire. Some of the items that were put into Senate Bill 131 make it easier for individuals to come back to the profession. If you've had a license that's been expired for over a year, it is half the cost to reinstate that license. We have those new 6-month temporary reinstatement licenses. Those should help a lot of people. And once we have things in more of a settled spot, I'd like to reach out to those individuals who are previously licensed just to make more people aware of what is now in law that they can utilize. But I'm concerned that if we do that right now with all the moving pieces, it may be too much of a juggle. So just want to make you aware that I haven't forgotten that piece. I think it is a really valuable piece and do want to spotlight that, but that may need to wait until next year when we have a few more things on a little more solid ground. Also, an update as far as the regulations for the BSRB. So as you're aware, the statutory changes are really what is in law. And if we want anything changed in statute, we would need to request a bill before the legislature, and that would go through that process with bill hearings and everything else. And then ultimately, the legislature would have a decision as far as passing the bill, and we'd go from there. With the regulations, you need statutory authority to have regulations. The regulations do help you flesh out your responsibilities under the statute. And so the only unfortunate thing about the regulations is sometimes the process to implement new regulations can take time. And so I'm just going to talk about it in terms of set 1, set 2, and set 3 of the regulation. Set 1 of the regulations we'll talk about is the fees. So last year, or earlier this year, but also kind of crossing over into last year, there was this discussion about certain fees for the BSRB. And then when Senate Bill 131 passed, it established fee caps for a lot of those new license types, but there needed to be specific amounts set in regulation for us to actually have the authority to issue those new license types. So one thing that we did to move as quickly as we could is to request the board's approval to put forward temporary regulations establishing those fees, knowing that we would be putting forward permanent regulations for the same amount. But if we had approval for the temporary regulations, we could start issuing those new license types once they were all set up in the licensing system. And so that's what we did. And we received approval from the board for the temporary licenses. We also went in front of a committee made up of members of the legislature, Department of Administration, Secretary of State's office. They reviewed those and they approved the temporary regulations as well. And so since that point, we've been issuing under the authority of the temporary regulations. At the same time, we have gone through the process to implement permanent regulations for those fees as well. And those permanent regulations for the fees, they essentially had to be held open for 60 days to allow time for public comment. there was an official meeting held here at the BSRB office. And so we went through all of those steps. And then at the October 23rd meeting, the board voted and approved by a roll call vote the adoption of the permanent regulation. And so since that time, they were published in the Secretary of State's Kansas Register, and they will become effective on November 17th, 2023. One small gap is that the temporary regulation that had to do with those new fee types stops operating on November 14th, 2023, and the new permanent regulations begin on November 17th, 2023. We will have a 2-day gap on November 15th and 16th. And per the board's direction, we won't be, we will essentially not be using those new fees for those 2 days. We will just hold items for 2 days, and then we'll be able to use the new fees that are in place as of November 17th, 2023. And so we're on pace for everything. By the end of this week, those should all be in effect, and it'll be nice to have that checked off the list. And so we will put something on the BSRB website to just kind of announce, but for a lot of people, they should see no change since we've been operating under the temporary fees for the last 4 months. So on a day-to-day basis, people are not going to see anything very different. It's just going to be something that will officially be in place, and we won't have to worry about temporary regulations anymore. I mentioned we'll talk about set 1, set 2, and set 3. So in terms of set 2, you may recall last year there was a lot of discussion about the requirements for licensure. And for some of the professions, there was discussion about currently right now in the regulations, it says, did you receive your education from a program that is accredited by the national accrediting body? And there's different accrediting bodies based on the different professions. And so if you did not receive your education from a school that's accredited by one of the national accrediting bodies, then you would need to meet alternate requirements and regulation, which are hoping to establish substantial equivalency for the accredited body, essentially. And so those alternate requirements and regulation for a lot of professions indicate that a certain amount of coursework needs to be obtained while the person is in residence, which is currently defined as being physically present at the school. And for 4 of the professions, there was interest in changing that language so that in residence would be defined as either physically present, or you could satisfy that requirement by synchronous face-to-face video conferencing. And so that would allow some of those new online schools to meet the requirements in the regulation. Those regulations were submitted early this year, and they went before the Department of Administration. They reviewed those, provided edits. It was provided to the Attorney General's office for review. They reviewed those, and it did take some time for those to get reviewed by that agency. Ultimately, they met with Leslie Allen and myself, provided some edits, and then those came back to us. And the way the process works is when there are edits, we need to do additional work on the regulations and then resubmit them through the beginning of that process with the Department of Administration, which we did. And then they take time to review, and they can make further edits, which they did. So then it came back to us. We made those edits, turned it back into the Department of Administration. They approved, and then it goes back to the Attorney General's office. So if you're following the pinball, we are currently now back to the Attorney General's office. We hope, fingers crossed, that everything looks good. They've already reviewed them and approved them once. We have some further edits. And hopefully, if they review these, the next step would be for these to be opened for public comment for 60 days. We would go in front of a legislative committee called the Joint Committee on Administrative Rules and Regulations. They would have the ability to provide feedback. So hopefully we are close to that step. Some of these, I believe, were originally stamped back in December of last year when we had submitted them through the process. And so we're very anxious to get these into place. I know based on conversations that we've had in our board meetings and advisory committee meetings, there's a strong interest by the board of having these in place. They will allow some additional individuals to qualify for licensure, not just now, but in the future. And so I apologize. I don't think there's anything more that we could have done from our staff in terms of moving this through the process more quickly. It's just that's just how the process works, unfortunately. And so we are continuing to go through this. And then once we hear back from the Attorney General's office, everything looks good, I will let you know. And then similar to the fees, it would be held open for 60 days. The one different thing from the fees is that there would be no temporary version of these regulations. Generally, you need a very strong reason why you have a temporary regulation in place. For the fees, part of this was we wanted to be able to start issuing those licenses as quickly as possible. There was also a fee decrease. The board had voted for temporary licenses, and so there really was a time element. And there is a time element here as well. I'm not sure this would actually meet the requirement for these to be temporary regulations. So, but we'll keep you updated as best we can. And then in terms of set 3, those are the items that we are currently discussing. So any items that were passed when we had submitted these to the Department of Administration and the Attorney General earlier this year. So the set 3 would include items like for the social work profession, I think there was language that previously said the postgraduate hours for someone applying for clinical licensure had to be no less than 2 years and no more than 6 years. And that's one of the changes that was the board had voted to remove is the cap on the 6 years. Also, any of the language currently right now that you're discussing in terms of the unprofessional conduct regulations, any of the other items you're talking about with continuing education, use of computerized technology, all of those items would be in a new set that would probably be going to the Attorney General and Department of Administration sometime next year. So, I don't think it's a bad thing that we have so many things moving. I think it means the board is doing a really good job being diligent in reviewing these regulations. As we've talked about before, the legislature did pass a bill that all agencies will have to essentially justify their regulations. And there have been comments by the legislature over the last few years that have said the agencies are not being diligent about reviewing them. So I think this is doing what we're supposed to be doing. It's a lot of work, but I appreciate all of your time in this, and we'll keep things moving along. In terms of other updates, I did get an opportunity to attend several national association meetings for some of the professions. And I really want to say a big thank you to the board members who attended some of these meetings as well. As a composite board is what we're called in other states. We have 7 unique professions that we regulate, and a lot of the national associations for those professions really provide good assistance. A lot of those associations develop a licensing examination that is used by those professions in terms of people seeking licensure to have sort of an independent and sensible examination. But they also provide assistance in terms of research and other items, model laws on different things. And so some of them meet once a year, some of them meet for a mid-year meeting and an annual meeting. But I just wanted to kind of highlight 3 of the annual meetings for the professions that were attended most recently. The first would be the annual meeting of the Association of Marriage and Family Therapy Regulatory Boards. This was an annual conference in Salt Lake City, Utah from September 26th and 27th. And I attended that conference with board chair Mary Jones. It was the first time that Mary and I have been able to attend that conference. And some of the major takeaways that I had from that is there was a push by one of the speakers there on universal licensure. And just to kind of clarify, while it was never called universal licensure, there was a version of universal licensure which was passed by the Kansas legislature back in 2021. We referred to it often as House Bill 2066, and that was a bill that changed some of the reciprocity requirements for military members, military spouses, individuals that reside in Kansas, and for those that intend to reside in Kansas. And like I said, it was never called universal licensure, but some of the elements that universal licensure supports is essentially holding a license in another state, a jurisdiction in good standing, having practiced for at least a year with a similar scope of practice. And there's a little bit of differences based on what state pass what. However, that is something they were recommending and requesting for a lot of the states that have not passed something along those lines. There was discussion about license portability, but one of the takeaways that I thought, they did a survey of individuals to find out why they really wanted portability of license. And one of the main reasons that they wanted the ability to have licensure in different areas was not so much because the licensees wanted to move around. It had to do more with their clients, when their clients would go on vacation or when their clients would move. And it was about wanting to help those individuals when they are traveling or relocating to another place. There was also discussion about changes in federal law. They referenced the new changes to federal law affecting reimbursements for Medicare for certain marriage and family therapists and professional counselors. There was also discussions about supervision requirements between different states and a move to allowing supervision by televideo, which is something the board had passed a couple years ago. There was discussion on ways to maintain protection of the public, and they did ask, if someone is licensed in 11 states and they're going for their 12th license, how do we know that they actually do know the rules for every state? And there was discussion about jurisprudence examinations in different states and who requires jurisprudence examination to verify that you do understand the rules of the different states. They also noted that there's been a growth in complaints, specifically involving supervision, social media, and confidentiality breaches. And then one other item is as we've been going to the different groups, we were looking to see if they had any information about exam pass rates by demographic breakdown, and they did not. But there were a number of other takeaways from that conference, and so I just wanted to highlight those for you. And Mary, do you have any additional comments from attending that meeting?
No, I think you summarized it really well. I was just grateful for the opportunity to go. That's certainly something I wanted to attend, and I thought it was really helpful just to hear the perspective happening across the nation. So really good information for our board.
Well, thank you. And I agree. I think, sometimes when this is true of a lot of different environments, but sometimes when you spend a lot of time in one group, you kind of get a very you get a view based on what you know. And it's helpful for us to go to these different conferences to learn what other people are struggling with or what they have already dealt with, to learn from their solutions. It was also interesting. I did hear a few comments from people that have interacted with our board, had some very good comments in terms of positive interactions with the staff members. There are a lot of other agencies in other states and some here in Kansas where their staff members do not pick up the phone. You will not be able to speak to somebody. You may get a call back, but you're definitely not going to speak to somebody if you just call their office. They want to funnel a lot of things through a call line, or they want you to leave a message, or other ones I've heard will just allow certain hours of the day for their staff members to return calls. And I have to admit, this is not something that I would prefer. I don't think it's the best customer service. But as things continue to get busier and busier, I understand why a lot of states have moved that direction. I just want you to know that there is a lot of positive feedback and people do appreciate what our staff is currently doing. Sometimes I don't always hear those things because people are used to interacting just with us. But for those that have interacted with other states and other regulatory boards, there were a lot of comparative comments from people. So I just want to pass that along. In terms of another association meeting, there was a meeting by the Association of State and Provincial Psychology Boards, ASPPB, that was in Cleveland from September 28th to October 1st. And I want to thank board members Richard Nobles and Linda Heisman Powell for attending that meeting. Some of the major takeaways, the number of individuals taking the license examination, the EPPP, is high. Association is interested in supporting states and advancing measures on diversity, equity, and inclusion. And I know the board has had a lot of discussions about DEI the last couple of years. The ASPPB was also, one of the takeaways I had was their legislative affairs division. Division is becoming more active as they are assisting states with different items. They've also noticed there has been a growing trend of deregulation in different states. And so they said if you need any help from them in terms of knowing what's going on in different states and laws changing, to let them know. They have established certain task forces to help out states as well. There is one that is focusing on educational equivalency reviews. I mentioned in Kansas, we have a process set up for individuals to attend the programs by national accredited bodies, but then for those that don't, there's another pathway for licensure. And they found that for the licensed psychology profession, the PhD level psychologist, 38 or 37 of 50 states allow licensure by substantial equivalency. But the problem is that there is not one set way in which to determine substantial equivalency. And that is becoming difficult, especially as there's a movement now from even APA accreditation moving away from coursework to competency. And so it is a challenge by the licensing board to really be able to evaluate what is substantially equivalent. There was also discussion about the EPPP. Just as a reminder, the board of ASPPB had voted previously that as of January 1st, 2026, any states that wish to continue to use that test for the licensing process will have to require both parts, EPPP and EPPP2, but they don't need to require that until January 1st of 2026. But there was a reminder about that. There was a mock disciplinary hearing, and there were takeaways of how states could respond to different items involved in disciplinary items. There was a discussion about potentially establishing a grid of penalties or punishments based on violations of certain unprofessional conduct. They talked about looking back at past orders and trying to determine this, but there was a lot of complications. And I think part of this is because when some individuals violate unprofessional conduct, it's not always one regulation that is violated. Often it is several. And so being able to figure out what punishment or what disciplinary remedy really attached to which of the violations, I think would be difficult, if not impossible. But I do think that there is some merit to having a discussion along those lines. I think it could be helpful to have a range to say if this occurs, there could be mitigating factors or exacerbating factors, but establishing something like that would probably take a lot of time, and it would be very challenging to do. But I think Virginia was one of the states that had done something like that, and it was helpful to talk to other states about that as a possibility. There was also a task force that is looking at accreditation of master's level psychology programs, and is also looking at perhaps coming out with recommended standardizations between master's level psychology licensure requirements. Right now, Kansas is one of 17 states that licenses at the master's level. So the majority of states do not license master's level psychology. And for those that do, there's a lot of disagreement in terms of what those level of practitioners are called. And so this is one of the reasons why the clinical level of master's level psychology is called licensed clinical psychotherapist. There was a brief that I put together for the board a couple of years ago that talked a little bit about the history and some of those bill hearings and the discussion along those lines. And so the task force that is looking at it from ASPPB, they shared some of their preliminary thoughts. These are not their final recommendations, but some of the items they talked about, so right now in Kansas, if you are a master's level psychologist, you must pass the EPPP at the 400 level. And the level that they recommended for their initial conversation right now was 450. Another item that they were sharing their thoughts about was currently they don't believe that the title psychologist should be part of the official license title of the master's level psychology profession. And so I think they had some alternate titles that they were proposing to use, but the word psychologist was a sticking point in terms of their discussions as well. They also talked about something, and this was not, I don't believe, fully developed, but they talked about maybe perhaps having tracks in terms of having a full scope of practice, and that there might be one track that was based on, if I remember right, one was based on more of assessment, and then one was based on more of treatment, but it sounded like they still had quite a bit of work to do on that. One thing that was clear, they said, is whenever they do come out with their recommended findings, these would not be something that all states would have to adopt. So if we thought in Kansas our system was working, we would not need to change to these new standards that they would come out for with the task force. I think one of the benefits, though, is that for the states that would move to this, there would be more standardization, which could potentially help with things like reciprocity. Because I think right now, if someone wants to move from Kansas to another state, there could be some difficulty knowing what this license is compared to a license by a different name. So we'll keep you updated, but those were some takeaways. They also had some discussions about looking at CE requirements and then maybe requiring jurisprudence examinations, kind of like what marriage and family therapy talked about as well. And before I move on to the next one, Linda and Richard, you both attended that conference. Is there anything else you wanted to comment on in terms of any takeaways you took from that conference?
The one question that I had that I don't know why I didn't even think of this before, but as those EPPP requirements change, should we consider having something on our splash page, right, our homepage, that, or like disseminate information? I'm pretty sure all the academic departments already know about it, but do we find ourselves in a position of making sure that we're informing the public, our future licensees, to be prepared for the upcoming change? I didn't even think about that while we were at the conference. That would have been a great question to ask at the conference, I guess.
No, I think that is something definitely to be thinking about and talking about. One item that was to be determined last year at this annual meeting did focus on the master's level psychology program, because as it's been described, the EPPP Part 1 is more of a knowledge-based test, and the EPPP Part 2 has been described as a skills-based test. And these are really developed with PhD level independent practitioners in mind. And so for states that license at the master's level, where you have, let's say in Kansas, you have one level that is not a clinical level, would they still need to take both the Part 1 and Part 2? And so that is something that was to be determined. And that still, I don't think, has been completely resolved, although there was a comment at the conference where they did say it was their initial thought that you would have to take both parts. And so everyone taking it would need to take both parts. But I don't know they've officially said that firmly. So.
And I think that you summarized what transpired at the conference very thoroughly. I was very interested in the discussions around continuing education credits and how to best determine competence in continuing education, and the discussion about the master's level psychologists was a robust and good discussion to have too. So I'm like Mary, I was very thankful to have attended the conference and would certainly like to have the opportunity to go again next year.
Well, I really appreciate both of you attending. You know, we are fortunate here in Kansas. We do have certain efficiencies by having 7 boards in one, basically. But I think that we also have a certain responsibility, and that there's a lot of weight on a limited amount of people in terms of knowing what's going on at the national level and being able to have these conversations. And so I really appreciate all of you. I know your time is extremely valuable. And so I appreciate you volunteering to attend those conferences, and really appreciated getting to know each of you at those conferences better and having discussions, you know, learning things with you, but also speaking with you about those after that time too. So really appreciate that. And then the last of the annual meetings I wanted to highlight was an update on the annual meeting of the Association of Social Work Boards, or ASWB. This took place November 2nd, 3rd, and 4th. And this I was able to attend with board member Andrea Perdomo Morales. And so just some takeaways that I had from that conference. A lot of the conversation was similar to what some of the other associations are talking about. There still is an interest in diversity, equity, and inclusion. And for ASWB, they've added a J where they say diversity, equity, inclusion, and justice. And there was a conversation about the examination for the social work profession. Unfortunately, a lot of the discussion on the examination was held during a confidential session. And so it's a little unclear at this point how much we can share. But I think as a broad takeaway, I think they are doing a lot of really innovative things with the licensing examination, and they have a lot of plans that they've already put in place, a lot more that are to come. One thing I think would be helpful, and I think it would be something that would be really good, especially if the legislature intends to have a discussion about licensing examinations or for social work. I think it'd be interesting to reach out to ASWB and maybe try to facilitate a webinar for maybe licensees in Kansas to hear directly from the individuals that create and administer the test, so that they can kind of explain some of the ways the test is changing. Because some of the things that they're doing have to do with the test itself, but some of them have to do with supportive measures. I know a couple things they've talked about outside of any confidential meetings have been that they have partnered with a new company, that if you take the examination and you don't pass the first time, you will be contacted by a company they've partnered with who will work with you to address different areas in which you may not have had success when you took the examination. And some of the other technical items, for example, for individuals who have low blood sugar, the ability to have a snack during the test, or looking at ways of addressing test anxiety. I think they're thinking outside the box, and then they're also looking at the test itself. Is this is a speed reading test, or is this really testing what's necessary? And part of that is moving from 4 point choice multiple choice questions to 3 choice multiple choice questions. And it may not seem like much, but over the span of a long test, if you're reading 3 answers that are possibilities versus 4, it probably will allow you more time to be able to think critically and pick the answer that's the best versus, if you are someone who is a slow reader, it can make a difference. And so some of those things I think would be helpful. And I'm not sure that that message is really getting out to everybody in terms of this discussion. So I think that might be something we look into. And we've already reached out to ASWB, who has agreed to provide an update to the Social Work Advisory Committee at the next December meeting. But I think it might be helpful if we can set something up sort of separate from that, and maybe a webinar just for licensees, just so they can hear some of that information as well. So in terms of some other items, there are some other states that are struggling with some of the same things that we are. For example, there was a change in federal law recently that we talked about in terms of military members and military spouses being able to practice in states under a form of license recognition. And I did share that in terms of we were trying to work through that. Now, when I shared that openly, some states had no idea what I was talking about, and it was the first time they had heard about that. So they really thanked me for bringing that to their attention. They could come around on it. Other states said that they are wrestling with that currently too. One contact that I was able to make from California followed up afterwards and provided 3 different documents to me. And so those are all really, really helpful, I think. They're things that California has put together to address this and will be making public here in the near future. And so I think that it allowed me permission to make Kansas versions of those documents. And I think with some additional tweaks, it will save us a tremendous amount of time. And I think it will create more of a uniform approach to states, which I think will be good for everybody involved. But I think that's one of the things that maybe I don't highlight enough from going to these association meetings. We have a certain responsibility as we are a member of the associations that we need to attend these. We need to vote on the business of the association. But it's a really valuable tool when we can go there and we can share problems and solutions, because we are helping out other states with our solutions and they are helping us with their solutions as well. So, and it saves a tremendous amount of time. We probably get more defensible things than if we were trying to recreate the wheel ourselves. And so there really is a big value in making sure we have attendees at these conferences. So I know we have a limited amount of time for the meeting today, so I don't want to take any more time about this association meeting, except Andrea, I really do appreciate you attending the meeting as well. And I wanted to see, did anything else from the meeting, anything else you would like to highlight from that association meeting?
No, I think you did a great job recapping. I am looking forward to getting together the Kansas social workers so that they can hear information from ASWBs directly. So hopefully we can get that going. So appreciate your support on those initiatives.
Thank you, Andrea. And thank you again for attending that conference. And thank you to all the board members. I feel very, very fortunate and very, very lucky to have board members that are generous with their time to be able to attend those. But I think it is really necessary, especially with the composite board, so we can bring these items back, and then the board and the advisory committees can have further discussion. On the rest of my report, there is an update from Jason Hess in your packet of material. He is the board's appointee on the Kansas Fights Addiction Grant Review Board. Additionally, I will be attending the annual meeting for SIPAC. It is the multi-state compact for PhD level psychologists. It's going to be November 16th and 17th. One item that's going to be up for discussion is there is basically authority to practice under SIPAC that people can obtain if they are licensed psychologists with a license active in a home state, but that ability to practice is limited just to them. However, in other states, a license can entitle other individuals to certain rights. For example, in some states, if you have a license, other people can practice under your license to a limited degree. And so what they're going to be discussing at this November 16th and 17th meeting, one of the items will be trying to clarify that the SIPAC privilege to practice is really limited to only the person who obtains it, and it does not establish any secondary rights to other individuals just from this ability to practice. That's one thing they'll be discussing. In terms of updates from the multi-state counseling compact, Laura Shaughnessy is the board member who is the compact commissioner for Kansas. I know she's been attending meetings for that compact. That compact is not fully operational yet. The Rules Committee is meeting, but I think they still plan to hopefully have that operational by the end of this year. If not this year, then next year. And then for the Social Work Multi-State Compact, I was contacted by the director of the Kansas chapter of NASW, National Association of Social Workers. She informed me that NASW Kansas was supportive of the Social Work Compact and asked if the board would be supportive of the compact. And so I know the advisory committee has discussed that, and there's a recommendation on the agenda for the meeting today that we'll talk about a little bit more. But I just wanted to let you know that I had received that contact. I do anticipate there will be a bill likely coming before the legislature next year on the Social Work Compact. Currently, right now, one state has passed it, and that is Missouri. But I think that was large part because the language wasn't finalized until the very end of February of this year. So it was too late for it to be introduced in a lot of states. And then the rest of my report, you'll see a lot of different dates for meetings. Tried to fill up my calendar as best as possible with different advisory committee meetings and other meetings around the state. We do have some other responsibilities from the governor's office in terms of putting together things like continuity of operations type items and some other things like that. So I just thought it might be helpful to kind of highlight those so you would have a better idea of the different things that I do on a daily basis and the rest of my staff. And so I want to thank them for their assistance with all those items too. So with that, I'll go ahead and end my report and see if there's any questions.
Thank you, David. Are there any questions? Okay, very thorough. Thank you for that. Staff reports are next.
And Leslie, unless you have anything additionally for the staff reports, I do just want to highlight the traditional handout we included in your packet, which shows the history of permanent licenses from July 2015 to current. As you can see, those numbers do continue to climb. We've added about a little over 100 licensees in the last 2 months above what we had before, and that is even after anyone who has licenses has expired. So we are still continuing to see growth in the profession. Just want to highlight that for you today.
Thank you for that. Are there any questions or comments from that report? Okay, very good. We'll go on to the Complaint Review Committee. Cindy.
You have the packet of information and statistics. I just wanted to look at one data point today, and it's in the disposition of cases reviewed by the CRC. If you look at the October cases reviewed, it has a much smaller number, and I just wanted to let you know that it's not a reflection of anything except that it was a smaller period of reporting than normal. It's not that the CRC isn't doing the same amount of work that they normally do. And I want to thank the CRC. It is a very time-consuming job.
And I do want to let the board know this too. In some of our shuffling of responsibilities, Joan Hahn is one of the other investigators for the board, but she has a unique position. She's split between licensing responsibilities and investigative responsibilities. And some of her current licensing responsibilities are being taken up by one of the new licensing specialists. So to facilitate that and to work on clinical training plans that we've received a lot of recently, I've had Joan take some time away from her investigative responsibilities to assist with more of the licensing responsibilities temporarily. It is not a permanent change, but it is something to kind of help us out as we go through this transition. So if you're looking and you see that the number of open cases has increased, that is probably in part related to some of that change in focus. But as I mentioned, this is hopefully just going to be a temporary change. And then after we have people a little more knowledgeable about their new roles, we can move things back. But just wanted to highlight this for you so you would know a little bit more about why those numbers are the way they are.
Thank you for that. Any other questions or comments? Okay. We'll go on to the professions reports, and we'll start with licensed psychology.
So the Licensed Psychology Advisory Commission, our panel, we met on Tuesday, the 10th of October, and we had a couple of different discussions. One had to do with a presentation from Dr. Joe Steinmetz, who's with PCSAS, and that is the Psychological Clinical Science Accreditation System. So it's a relatively new accreditation system that has been put forward, and a number of universities have joined the accreditation system and may drop APA accreditation. So he presented to us about some of the ins and outs of PCSAS. We also had a discussion about the ASPPD meeting that David described earlier in our meeting, and that was a robust discussion. We also moved on to talk a bit about the unprofessional conduct regulations. We tabled that discussion because there are a number of regulations that we would want to review that are that other professions have in their regulations that we may not have or we do not have in our regulations. So we will return to that discussion. And the next advisory committee meeting is Tuesday, the 12th of December, 2023 at 6 p.m.
Thank you for that, Richard. Social work is next.
The Social Work Advisory Committee met on October 20th, and we reviewed again our changes in the clinical training plan and changes in regulation about continuing education, both what counts as continuing ed and documentation. We also had a discussion again about the social work multi-state compact, which we're hopeful will be introduced and adopted by the legislature in the next session. We spent a lot of time talking about questions we want to include on a survey to be sent out to Kansas licensed social workers, including questions about CEUs, about the ASWB exam, whether or not we want to get some kind of a read on who might be interested in the multi-state license to try to get some kind of an idea of how many Kansas social workers might want that license. And I think David was going to be working on putting that survey together. Yes.
That's right.
And then we also talked about some workforce issues. We reviewed those meetings with academics and employers. I did attend the meeting with the academics, and I think I asked David to send everybody the slide deck. I thought it was very well put together, and it was a really productive meeting. So I think you used the same slide deck with the employers, right, David? And so hopefully that'll be something we can repeat and keep that communication going. And then we talked about consideration of the student temporary license model as well. And our next meeting is going to be on December 5th.
Okay, thank you for that. The next group is professional counseling.
And I'll go ahead and cover this because Laura is out today. The Professional Counseling Advisory Committee did meet, and there was discussion. They discussed topics including supervision and possible changes. We discussed from the most recent board meeting, the discussion about an alternate change to the 45-day language for supervisors. And then there was some further discussion too about other items involving professional conduct. And so that advisory committee will be meeting again in December.
Great, thank you for that. And Master's Level Psychology.
Thank you. The LMLP LCP Advisory Committee met on the 20th of October. We introduced David Stevens as our new public member for the advisory committee. Had several discussions, a brief discussion on the APA's work on standards for accrediting master's level psychology programs. Continued discussion of recognizing APA accreditation from LP programs as satisfying accreditation standards for master's level psychology. BSRB staff will be contacting some universities to look into program requirements in the first 2 years of those programs. So those would be PhD students who finish the first 2 years applying for LMLPs in the state of Kansas and making sure that they do meet the current accreditation standards for that level of licensure. We had a discussion on the regs around computerized psychological testing and discussed adding language that the person administering the test have appropriate training and competence in relation to the specific test being administered. Also, continued discussion on proposed changes to unprofessional conduct regulations. That's been an ongoing discussion at this committee, but I think we finally completed our review of that and recommended several changes to the language in our regs. And we began a discussion on applicants for LCP licensure taking the EPPP early, and we'll continue that discussion during our next meeting scheduled for the 11th of December. Thank you.
Thanks, Dave. Next is marriage and family therapy, and we have not met since the last report at our last board meeting. So we will have our next meeting on December 12th. And I think we'll have a lot of discussion around unprofessional conduct regulation and also a couple of follow-up items with respect to supervision. Addiction counseling is next.
The Addiction Counseling Advisory Committee met on Friday, October 16th. There was continued discussion of unprofessional conduct based on review of other disciplines, and I believe that proposed language was approved by members of the committee. We also discussed some of the items that were discussed by the larger board regarding 45 days update to clinical training plans, cleaned up some language on documentation for continuing education to update it to consistent with current technology, removing maybe videotape and audio tape from some of the language. Then we just started a conversation about addictions counseling licenses versus accreditation, or that might not be the right word, in other states, and if reciprocity, if there's an alternative based on years of experience versus licensure. But that was a beginning of a conversation, and we're going to examine what other states' requirements are, and we will meet again on December 14th.
Great, thank you so much. Behavior analysis.
We met on Friday the 13th. So we met on October 13th at 1 o'clock. We welcomed 4 new board members. So we decided to stagger them in so that people aren't all exiting the board at the same time. The majority of the meeting was taken up with training of new board members. And so we did get to a little bit where there is a program out there, KMAP General Bulletin number 23230, that provided a new service in the state of Kansas called the Children's Behavioral Interventionist. And the people that can oversee that, which would have been a licensed mental health provider, which is different than a qualified mental health provider, et cetera, et cetera. They got clarification from the state that behavior analysts are included under an LMHP, and so which opens the door for behavior analysts to see people other than those that are impacted by autism. We did touch a little bit on some of our other agenda items. We're gonna look at cleaning up some of the continuing ed and documentation of continuing ed. A lot of it we held over to our next meeting because we were short on time after our training. Looked at also some of the stuff that one of the others of you discussed, which is removing like audio tapes and whatnot from our language in there so that we're cleaning it up and seeming more like we're in 2023 and 2024 instead of 1989. And then we're going to meet quarterly. Is it quarterly or every other month? David, do you remember?
I believe it's every other month.
Every other month, thank you. Every other month. So our next meeting is set for December 8th at 1 o'clock via Zoom, and we should be able to knock out the rest of the stuff on our agenda. Thank you. End of report.
Thank you for that. I appreciate it. David, are we ready for our guests? Do you know if they're here?
Yes. So at the last out-of-town board meeting on October 23rd, I had mentioned a group called CE Broker, which does provide services to some other states. And recently they've had agreements with the Board of Healing Arts and Board of Nursing. And I asked the board if they would like an informational briefing by that company. They do think that they could offer some services to the state of Kansas, and the board was receptive to that. So I'll go ahead and let them in. There's about 4 individuals in the waiting room, and I'll let them in so they can provide that presentation to the board.
Good morning.
Good.
Good morning.
Good morning.
And Tom or Amanda, you're the 2 individuals that I've worked with the most, but I did just let the board know, it's just kind of a recap. At the October 23rd board meeting, we had discussed a few different items, and I had referenced CE Broker as a company that had presented information to the board about a year ago. And then we had to work on some different items, so we were kind of returning to the conversation. And I asked the board members, since there's about 3 new board members since that time, if they would like more information from CE Broker, and they said an informational presentation would be helpful. So I reached out to you, and we've had some conversations recently as well, and appreciate your time today and presenting information to the board. But so I just wanted to open it up for you and see if you could provide some information to the board and then maybe answer some questions by board members.
That sounds great. Thank you, David. Can you see me okay? Everyone, you seem frozen on my end, and I just want to make sure I'm coming in clear.
Okay. Yeah, I think we can see you all okay.
Okay, perfect. Yeah, give me a moment here as I share my screen. Good morning, heading on afternoon here to everyone. All right. Great. Is that visible? Full screen for everyone?
Yes, we can see that.
Okay. Perfect. As I said, good afternoon. Lovely to see everyone on screen here today. I'm Amanda Lipinski, our account executive here at CE Broker. And I have a couple colleagues on my line, but notably, as some of them may be fielding some questions here, we have Marcia Mann, our solutions consultant, as well as Tom Goodrow, our head of sales as well, to support today's conversation. Thank you so much for your time. All right. Second. For the agenda, I'm going to give a high-level overview of who we are as a company for those of you who may not be as familiar, dive into a high-level summary over our solution, the board suite, licensee experience, a little on our no-cost model, and then touch on some pieces around implementation, support, and security as well. So that's what I always like to kick the conversation off with, why us meeting today is important. We really value and respect how crucial CE renewal is and your roles in it, and appreciate what you do. That said, it's a very complex process as well. There's a lot to manage. A lot of information lives often in disparate systems, legacy systems, and that results in a lot of manual efforts, often on the board staff, and a huge administrative burden. And so we at CE Broker really work to solve that. We're part of the Propellus brand, and for over 20 years, we've been powering professional progress, not only with boards and agencies, but also with associations, employers, ensuring that millions of professionals stay clear to work and compliant, specifically in the medical sector. All right, so in terms of what we do, CE Broker is a software solution. We're the most complete, trusted continuing education management solution on the market today. We're the only one that truly unifies these groups you see here, our board staff, our licensees, as well as education providers into one ecosystem, into one simple, easy to use solution, really simplifying the CE process, making it faster and more efficient for all parties involved. As I mentioned, we've been in the market for over 20 years. We started with the Florida Department of Health 20 years ago. We celebrated that anniversary just a few months ago. And since then have had over 250 licensing boards utilize CE Broker, over 10,000 education providers today, and over 5 million licensed professionals utilize our platform. In addition to that, over 350 unique professions, which really speaks to how customizable and extendable we are to accommodate your unique profession requirements and any rules and regulations that may occur at the state level. The last thing I want to add on this slide is this kind of last bucket right here, connected to the community. We're really proud of this. And again, it's rather unique to us here at CE Broker. We have a team, our external affairs team, who's dedicated to building relationships both at the state and national level, continuing the conversation around modernization in government regarding CE. So we really care a lot about being a partner to you today into tomorrow. Any questions on that piece so far? All right. Going a little into some of who we work with. So we've proven success in the mental and behavioral health space. Wanted to share some logos we work with currently: Florida, South Carolina, Ohio, Tennessee, North Carolina, West Virginia, Michigan, and Wyoming. So we understand the unique challenges around these professions. And unique to you, we do partner in Kansas today with the Board of Healing Arts, as well as the Board of Nursing. I believe the Board of Nursing went live a few months back, and I got to meet some of them as well at a conference recently. All right, stepping into our product overview a little bit here. First, I'm going to start on the board suite and how we support board staff. Ultimately, the goal here is to be a partner in modernizing your operations and how that really ties into your strategic initiatives. At a baseline, it's taking a lot of those manual processes and turning them into paperless systems, saving time for your staff. And from the audit standpoint, it's making that process a very simple, quick online verification process that you can also run reports on for your licensees to better increase compliance across the board. A good example of this was the Louisiana Medical Board. They came to us and were utilizing 4 individuals to run their audit process. And once they implemented CE Broker, we're able to reduce that down to 2 individuals. And the remaining 2 then could be focused on other higher priority initiatives within the department. So lots of great gains there. And the piece I do want to call out for this is our compliance at renewal, or compliance connect you might hear. This is something we've spoken a bit with David about. Basically, we integrate via API with your licensing system today. And as a professional goes to renew their license, one of 2 things will happen. So the system will ping CE Broker to see if they're currently compliant. If they're not, in option A, the licensee will get a pop-up merely notifying them, if you proceed forward, you're currently not compliant, you may be audited down the line, but they can still continue with renewing their license. And that seems to be a good fit for your board based on our conversations, because I know you all want to be mindful of keeping the barrier to entry to renewal rather low today. The other option, though, we also do support and are seeing a trend more in this direction, is a little bit more of a harder stop, we call it, where when the licensee goes to renew, they receive a notification and it will not allow them to renew their license moving forward until they complete all the requirements. That is something that the Florida Department of Health utilizes today, just for reference, and utilizing the compliance at renewal, they've seen over $500,000 worth of savings each year by increasing compliance in this way. So some pretty powerful metrics there. But either way you go, it keeps your licenses informed to their status. Moving to our licensee experience, really important here. We want to make it a fast, easy experience for all those involved where they can go to one location and find everything CE. And that's ultimately what we're doing. Every licensee will get a free basic account, and it provides them with all the power you see here on the slide. So tracking multiple licenses across state lines, storing, uploading documentation, certification, records, things of that nature, course history, requirements, and communications, reminders, and of course, help on demand, which I'll touch a little on the end. But the one thing I want to call out here is our mobile app. Another great differentiator, all the functionality you would get on your web browser will also be accessible in the palm of your hand. This is available on Apple as well as Android. Again, further tying into modernization, increasing technology at the state level. And lastly, on the licensee piece, so I referenced everybody gets a free basic account and that we are a no-cost solution. So how does that work? We do have premium accounts that professionals can opt into voluntarily if they so choose. So in the basic account, you can think of this as a little bit as TurboTax. You start there, you can execute everything you need to do, get it done, and get out. However, we do have a professional account that includes our compliance transcript. This is really powerful. It's color-coded, and it will tell you what you've completed, what hours are remaining, and then what courses would suit those remaining hours for you to complete renewal. A lot of power in that, so I don't have to track it myself. The system's going to do it for me in a very easy to use way. And then in the concierge account, it adds the dedicated account manager. This is your personal assistant. So this individual can enroll you in classes, they can do your tracking for you, report on your behalf, anything that you would normally do, they can take over for you. These are really powerful, I will say, for individuals in the medical sector. We see that they tend to opt into higher profiles, or multi-state licensees are going to really love these more premium accounts. Any questions on the account piece or the licensees? No. All right. Doing good. I did want to do a quick call out here. We do have our CE provider marketplace, kind of that third piece of the coin there. And this is unique because if I'm a licensee, I don't have to actually leave the CE broker platform. I can stay within it and find courses that'll be relevant to my my certificate. So I wanted to do a quick call out here. Providers may also report that directly into the board, and you can pre-approve them as well. So again, it's simplifying the whole process, bringing you all into one system here. And I did want to touch on that briefly. And if not, licensees can just report their own CE on their own in the portal as well. Either way works. All right, a couple more slides here. I'm going to transition a little more to our security pieces, as well as once you're working with us, what does that path forward look like? Security, I know this was important to the board, so I do want to touch on this as well. Having been in government, worked with municipalities, we get it. It is the utmost important to us as well as the industry at large. Our platform is compliant with FIPS, encrypted at rest and in transit, as well as being DSS compliant. We have multiple data centers for stability, scalability, and monitoring. What I want to hit on here is that the data on our system is 100% accessible and owned by the board. No data is collected that doesn't pertain to CE requirements, and no data is disclosed to any third party. So a lot of what we ingest kind of in our initial implementation kickoff is public domain materials. So we're talking things like first name, last name, license number, license expiration date, things of that nature. Really important, and I did want to touch on that here. So implementation, two things that are really unique to CE Broker. Number one, implementation. We do about 90% of the lift for you and truly are a partner with you from start to finish of your journey. That includes collecting your board rules, configuring the system, testing it, executing training with you and your staff, as well as providing you with copy and communications that you can utilize to introduce your licensees to CE Broker, share on your website, sort of promote the services, if you will, to help increase adoption and ensure a really smooth transition. So we help you with a lot of the communications there. What we ask in return for that is about, I would say on average, 2 to 4 hours of your time. And that includes attending our kickoff rule verification meeting, providing us with clean data, answering any questions around that, as well as attending a training session right at the end, so you know how to use the platform. And last but not least, so our support center. One huge reason, we have our case studies on our website, and something that you'll find common across the board is how many boards decided to move forward with us due to how much we support them and their licensees within the support center. This is included at no additional cost, based in the United States. They're available 8 a.m. to 8 p.m. Eastern time zone, Monday through Friday, for your licensees. Email, live chat, as well as phone. So whatever channel is your preference there. And the way it helps the board is a lot of times I'll hear from individuals that they get an influx of phone calls, emails, you name it, of, I don't know what else is left to fill my requirements here. What's the deadline for X, Y, and Z? And so we alleviate that volume from you. We absorb that away from the board, and provide a really top tier level of support to your licensees, so they're empowered to have a seamless experience renewing their licenses. All right. And that is everything on my end I have in terms of a formal presentation. I'm going to pause screen sharing here though, and myself and my team are happy to address any and all questions from the board today, should you have them.
I had a question, just wanted to clarify that the licensees are able to take any CEs from anywhere and put them into this portal. They don't have to just take from the education, the CEs that are offered through the platform.
That is correct. Yes, they would just be self-reporting it. So in essence, putting in the information on the provider and uploading, if they do have a certificate, PDF, JPEG, for proof of that. Correct.
Thank you.
And also, I thought I would go ahead and add this to, so I know that there are different models utilized in different states, and some states may want to require all licensees to participate in something like this. But if there was an option in the state of Kansas where we wanted to make it more of an opt-in approach, is that something that would be available for our state as well?
A good question. Tom, can you take this one and the phrasing on that?
Yeah, and David, can you clarify again what you're asking? I just want to make sure I understood the question. So are you talking about making it optional versus a required solution for your boards?
Right. We have about 15,000 licensees, and I think that there are some that would really see a big value in this, but some like to do things the traditional way, like with renewal. We have about 90% that have moved to an electronic process, but 10% continue to renew on paper forms. And while we hope that they would move to that at some point, we like the flexibility of giving people a choice. And so in terms of utilizing CE Broker, just kind of wanted to see if individuals, if we could have a model where individual licensees would be able to opt in, or if it would be something that would be required for all licensees.
Yeah, no problem. Yeah, and I think we'll absolutely work with you and your boards to work through that. I think ultimately it sounds like the majority of your professionals would probably embrace this, think it's an advantage for them and utilize it. And we can put together the right licensing engagement plan together with the boards. I think that would be phenomenal. And then others will probably come along later. We definitely have, boards today, and I'm sure Marcia can speak to this on our team, that, some of them haven't even claimed their free account. They are doing it the old fashioned way, and it's hard to get everyone to participate. But I think if we could head towards that soft stop that we talked about the other day, David, that would be ideal. But we can kind of do a walk, jog, run with you guys if that's what makes sense.
Yeah, I think just from kind of our discussions, I think when, especially in this age where there is some issues occasionally with different companies with information sharing and people wanting to make sure that everything is secure, having the ability to opt in on it might be something that would be more palatable for people. But in terms of encouraging people to sign up for a company, if the board is supportive of moving this direction, I see a real big benefit to our licensees. Right now, they have to maintain all their paper records and then physically mail those in a lot of cases to the board. And so this would be something where they would not have to worry about that issue or something being lost in the mail, or potentially if people change jobs and they can't access information in past email accounts or different things like that, or the speed by which our staff would be able to review these things. So I see a lot of benefit, but I think just in case board members might have questions afterwards, it would be helpful to kind of know what might be required of the board if we entered in an agreement. So I wanted to ask that question.
Great. Yeah.
Thank you.
So I'm just going back to that last question. I didn't hear a yes or a no. I heard work with. Is there an opt-in available?
That's how it works. Yes, the answer is yes. We'll work with you on that.
Okay.
Ultimately. And Marcia, do you want to shed some light on this, maybe from our perspective too? I think again, I want to make sure I'm talking about it intelligently. But whenever we work with any board or agency and we put this program out, you're going to have a number of your folks that are going to opt in right away, and you're going to encourage them and provide all the benefits and that kind of thing. But then there's going to be a certain percentage that won't take advantage of even a free basic account. They won't ever log in and do that. And I don't know, Marcia, if you can shed some more light on that piece.
I'm fine with the answer to that, as long as I heard a yes. That's all.
Very good. Thank you.
So for those of us, some of us are dually licensed, meaning we're licensed under more than one profession. So how, for those CEs that would satisfy requirements for both licenses, how does that work? Would it have to be entered twice under different license options, or is there a cross-platform referencing that occurs?
Marcia, can you take that one?
Sure. If it's, and when you say multiple licenses, are you talking about under your board?
Yeah,
Or-
for example, like licensed psychologist and licensed behavior analyst.
Okay. Yeah, you can have one account in CE Broker with multiple licenses tied to it, as long as they are licenses, in a state where we are working. Currently, if you're self-reporting the continuing education, you would have to enter it for each license. We're working on methods of like just reporting it once and then maybe indicating it goes to this profession, this profession, this profession. Right now, you would have to enter it twice, but it would all be contained within the same account.
Very good. Thank you, Marcia. Linda, did that answer your question? Wonderful.
Well, it did answer the question. So do you anticipate coming up with, an option to where you enter it once and then you select the different license types that it applies to? So when you
Yes.
call for, and do you have?
I do not have a time. I'm so sorry. But it is something that's been top of mind for our leadership for quite a while. It's becoming more and more of an issue as we grow,
Yeah.
You said that if you were self-reporting, you would have to enter your CE twice. But just if you're using CEs that you access through a CE broker, you don't have to enter it twice?
If it's an educational provider that's approved by your board, then they could have all of the professions, on that one course. So if you take that course, then the CE would populate to all of those licenses. You wouldn't have to. Yes, it's only when you're self-reporting that you would have to do it twice.
Okay, thanks.
Any other questions from the group?
And board members, in case you think about this afterwards, I mentioned I've had some conversations with representatives from CE Broker, and those are going pretty well. At the last board meeting, you had requested for me to get a copy of the statement of work or the agreement that they could potentially use with the Kansas board. And so I have reviewed that, and we've had a conversation where we've talked about that. I also just recently sent a copy of it to Tim, the legal counsel for the board, and asked if he could review it and then provide some feedback as well. And then in terms of IT security issues, I also mentioned that might be something just to make sure that everything is covered. And Representative from CE Broker said they'd be happy to have a conversation with our IT support staff from OITS just to make sure that's taken care of as well.
Yes. And looking historically too, David, it seems to be something we've gone through with the Board of Healing Arts as well as nursing. So there's some historical precedents as well where we've been able to successfully partner there. So look forward to that. Sorry, everyone's frozen on my end. I think my connection's poor, but happy to stay a couple minutes if there's any other questions. I'll give it a moment here. Nope. All right, great. Well, what I can do is I will send David the deck. I'm going to actually I'll include my work email on the very last slide. So if anyone has any personal questions, feel free to direct them to myself. Happy to answer them or anyone on my team here. But if that's it, I really appreciate your time today. Look forward to hopefully supporting the board here moving forward, not only your staff, moving you away from manual processes, but also really support your licensees with some really powerful tools as part of their process here. So thank you again and have a wonderful rest of your Monday.
All right. Thank you.
Thanks, everyone.
Thanks, everyone.
Dave, I would suggest that we entertain a short break for everyone and then come back and maybe have some discussion about the presentation.
Okay. Yeah, on the agenda, the next item up was the 10-minute break. So.
Oh, okay, I hadn't moved farther. I didn't know if we wanted to have this. I'm sure we want to have discussion, but I thought probably everyone's ready.
No, that sounds like a good idea. So I'll put everyone back in the waiting room, and then we can just kind of pick things up. 10 minutes sound good for a break?
Sounds good.
All right.
Thank you. Sorry about that. It looks like we're all back now. Can you hear me, Dave?
Yes, yeah.
Okay.
Looks like everyone has returned from the break.
Okay. All right. So did you hit the button already?
Yes, we are live.
Okay. Perfect. Okay. Any discussion regarding the presentation from CE Broker?
Well, the only comment I'd have is I hope it's optional and we don't require it. I mentioned to David on a sidebar that I've been trying to log into my free CE Broker account since July, and I haven't been able to. It doesn't recognize my license number. And then, of course, when it goes to the Kansas Board of Healing Arts, I don't have myself open to public share because I don't like getting all the spam associated with public sharing your license. So, and when you call, they can only change it once. So if I did my license renewal and I put do not share, that's how it is for the year. So just probably more of a personal problem, but just thought I'd relate my current experience.
Okay. Thank you for that.
I want to agree with Jim because I would also like it to be optional. I think I appreciate the philosophy behind it to try to decrease time. But when you have problems like what Jim just reported, that's some of the problems with free accounts. Probably they don't tend to put as much time, energy, and effort into that. So they probably it might be better for paid accounts. And then for us, I mean, that was going to be my question. It's no cost to us as a board, right? The
That's
cost
right.
would be, would there be like a minimum number of enrollees that would be required for them to be able to say that Kansas uses their product?
There's not been any discussion about that. Basically, if we were to contract with the company for an amount over $5,000 over the life of the contract, in most cases with an outside company, we would need to have that competitively bid through an RFP process. but because there is no cost to the state, so there wouldn't be any cost to Kansas or to the BSRB. And so that's the way that we're able to kind of talk to them directly and then work out an agreement. And so that would have to remain cost neutral. Otherwise, it would need to be something that we would need to put out there for competitively bidding. And for the individual licensees, the way that it's set up is, yeah, the individuals would have the ability to opt into the free account, and then where they would make their operating revenue would be for the individuals that choose to elect to a paid account. And so, but over the lifespan of the agreement and our preliminary conversations with that, these would be about a 3-year agreement, that there wouldn't be a cost to the state of Kansas. And if that should change, it would probably need to be competitively bid. So I think there's a fair amount of security with that.
Right. And so then I think it becomes even more important for the opt-in process, because if at the end of 3 years, it becomes a paid contract, and then we decide somebody else gets the bid, or we decide that it's cost prohibitive. Now we've just had 3 years where our licensees have been depositing their CEs into this database, and then we decide to not do it, right? So I think it's definitely got to be an opt-in thing.
And also, go ahead.
Have you had conversations with other state boards that are using this and gotten feedback from them about? We all know when somebody makes sales pitch, it sounds great, but whether or not they find it to be both from the board's perspective and the licensee's perspective to work as well as, they've kind of laid it out for us.
Yeah, so it's a little challenging here in the state because there's only 2 agencies that have contracted or made an agreement with them, and that would be the Board of Healing Arts and the Board of Nursing. And I think those both went live relatively recently. So I have heard that there have been good conversations between those 2 agencies and CE Broker, but in terms of having a length of time to really evaluate that, it's been too short. But I think in terms of people from other states, I have heard from other people who have used them in other states, and they say that it works pretty well. So in general, I've heard pretty good comments.
Do we know if once someone has claimed their free account and started to use it and maybe had problems like what you were describing, Jim, can the individual opt out, or are they stuck with it for the duration of the 3-year contract?
That's not something that I had talked with them about, but I'd be happy to get an answer for that question.
So I haven't had a problem opting out. I've had a problem trying to get in, and I was just trying to play with it and test it. Quite frankly, I did it while they were talking to us this morning. It's been sitting in my inbox for 4 months, and it still won't let me in. So they did send me an email that told me I could be a professional member for $19.99 a year. I have no idea what that means, but my professional society already monitors all of my CEs. I uploaded to them based upon my membership dues there. So it really doesn't help me. I can just send it over that way.
I think the other thing, going back to Linda's point, is if we do decide to go with this company and launch it, just being very clear that this is a 3-year opportunity for people to opt into, and at the end of the 3 years, we would have to reevaluate and potentially transfer your information, or I don't know the wording, but just making people know upfront that there's a time frame to it.
Right. If people are in the middle of their 2-year relicensure period, when we decide not to re-up the contract, then they've got half their CEs already in CE Broker, and now they have to retrieve them and submit them in some other way. So that is a risk.
And just so that I'm clear on this, if the licensee did not obtain their CEUs through the CE Broker CE broker, CE platform, thank you. If that's the case, that means that the licensee would need to upload all of those credits themselves, right? So that's where I think that we would need to do kind of the soft stop model where instead of the hard stop, because if it's incumbent upon the licensee to enter those credits, and if they don't have a certain number of credits per the system when they go to renew their license, that could pose at least a problem of confusion for the licensee, because if it's the hard stop, they would not be able to proceed on to engage in the renewal process.
If a licensee is applying for renewal manually on paper, and that licensure renewal is chosen for audit, would that audit still be completed by hand? Would a person have to upload certificates to the system?
I think they would, as I understand it, they would have a choice. So those two things are kind of independent.
Okay.
We have a system in place right now where if someone renews electronically, 10% randomly are pulled for audit. And same thing is true when people renew by paper. They just get selected, and the system just tells us which ones are selected for audit. And so if it was pulled for audit, I think what we could do is we could check the CE broker system to see if that's someone who has registered for the account and has uploaded their CE materials. And if they have, we could potentially use CE broker even for the paper ones, if those are people that renew by paper but still use CE broker. If they don't, then we would do what we normally do right now, which is we would reach out to them and say, you've been selected for audit and you need to provide supporting documentation to show that you've met all the hour requirements.
Thank you.
Well, really good comments, and I think some thoughtful questions that we might have some concerns about for follow-up. I think I would make a recommendation that we captured our preliminary thoughts, but maybe put this back on the agenda for the next board meeting to see if we're ready to make some type of decision, or if we need more follow-up information. It sounds like maybe there are some things even Dave could follow back up with and get some clarification for us, just to make sure we're going into anything with our eyes open. Does that sound okay with the board?
Yeah,
Okay.
I don't want to sound too negative. The Board of Healing Arts does this, the Board of Nursing does it. Between the two of them, they've got a boatload of licensees. So I don't know that, there's much you can look at other than David perhaps talking to the executive directors of those organizations. I'm just relating my personal experience, what I found as a limitation, and I don't want to portray myself as an expert, satisfied or dissatisfied, either way.
Understood. Thank you, Jim.
Would it be possible for you to talk with your counterpart in one of those other states where the mental health board is using? I don't know if you already have relationships with any of them. There were like 8 states, I think they said, had Florida, South Carolina, Ohio, Tennessee, North Carolina, West Virginia, Michigan, Wyoming. If any of those that has had longer experience than our state boards that are using them.
Yeah, I've got pretty good contacts in Ohio, and depending on which boards use it in Florida, I can reach out to them and have some conversations about that. So yeah.
I think that would be helpful to us in making a decision.
Okay. And in the meanwhile, I'll continue to review the language in that draft agreement they have sent and work with Tim, and then kind of continue to maybe have conversations with the e-broker to kind of see if, what you have expressed today can be reflected in the language in the agreement. And then that way that'll continue to move forward. That way at the January meeting, maybe we can talk a little bit more about some of those items as well.
Okay, sounds good. transition to the old business items on the agenda, and we had some follow-up items from the day retreat.
Yes, and so basically I had listed 4 items here, but some of these are going to overlap a little bit. For the board's out-of-town meeting on October 23rd, one of the topics that was discussed by the board was the current language in the regulations that says individuals accruing hours of supervision or individuals accruing hours towards a clinical license for every 15 hours of direct client contact, they need 1 hour of supervision. And so there was a lot of discussion about that. The board ultimately came to a decision to go ahead and remove that language from the regulation. And Leslie has presented some copies of the regulations for your review with some of the mock-ups. So also there was language about under the second item, proposing an alternative to the 45-day requirement to report changes to a approved clinical training plan. And ultimately, the item that we had proposed to the board to remove the language calling for hours after 45 days to be stricken, that language be removed, which would give the board the ability and the agency to review those hours. And if they're still in accordance with what the regulation allows, we could approve those hours at the end. And if they're not, the board could have a choice in terms of those hours. And so basically, Leslie has provided several different regulations in your packet. There's a copy of KAR 102-2-8 supervision. That's for the social work profession. 102-2-12 licensed specialist clinical social work licensure requirement. There's a regulation for professional counselors in 102-3-7A. Postgraduate supervised professional experience required to be licensed clinical professional counselor. There's a copy of KAR 102-4-7A, postgraduate supervised professional work experience requirements for the master's level psychology license. KAR 102-5-7A, professional postgraduate supervised experience required for a clinical marriage and family therapist. KAR 102-7-6, professional postgraduate supervised experience requirement for a clinical addiction counselor. And that's the last one. And so those were included in your packet. I've gone through and highlighted some of the underlining and the change to those mock-up regulations. And Leslie, do you want to just kind of talk a little bit about some of the changes in the regulations there?
Sure. So social work is different. They have 2 regulations. One is for supervision and one is the actual licensure requirements. So in 102-2-8, page 6, it strikes, it's 5A, supervision, meet accordance with 102-212C4 with the supervisee for clinical supervision throughout the postgraduate supervised experience. And then I struck for at least 1 hour of supervision for every 15 hours of direct client contact. And then on page 9, I struck if the supervisee fails to submit the changes to the board within 45 days that the hours accrued will not count. But then I also had to, in 102-212, I also had the changes were, there's a couple more changes because there were the changes that the board recommended for the 200 hours if they didn't have a clinical practicum, and that is on, it starts on page 2. And they also in the last legislative session struck the 15 hours of graduate coursework. So they only have to, LSCSW applicants only have to show that they have a 3-hour course in psychopathology. So that's what the changes, the additional changes on page 2 and 3 are about. And then also in number 2, at the bottom of page 3, the board voted to remove more than 6 years so that there was no limit on the number of years that the social worker could complete their hours. It used to have to be completed within 6 years. And on page 4, theirs is their postgraduate supervised experience direct client contact was changed in the statute and in the last legislative session. And so they have 1,500 hours of direct client contact, but it's including but not limited to conducting psychotherapy and assessment. And that is on the top of page 4. That's why that's there. And then in number 4 on that page, we struck the 1 hour for every 15 hours of direct client contact. And that's it for 102.212. For master's level psychology, professional counseling, and marriage and family therapy, their regs are set up very similar. So on page 1, I said except as provided in subsection B, each applicant shall participate in at least 100 hours of supervision, and then left all of that information about how 50 of individual, etc. And then I also I added a change that I would like to point out on page 5. Let me see which one I have up. Okay, this is for professional counselors. So on page 5, I thought that all the regulations required an official position description with their training plan, but they did not. Social work and addiction counseling do, and the other professions did not. So I put that language in as we were trying to make them all uniform. And that was something that was overlooked in the past. And then on the last page, page 7, again, just striking the language that they have to do it within 45 days or they lose the hours. And so for all 3 of those professions, the same changes in the same places. And then 102-7-6 on page 1 is this where I struck the 1 hour of clinical supervision. And then page 8 has the striking of the 45-day requirement or losing the hours. And if there are any comments or concerns or changes, if you would let me know, and if not, then if you approve them, I can start them forward in the process to go to the Department of Administration.
Thank you, Leslie. Are there any questions or comments about those changes?
We had a lengthy discussion about the 45-day requirement, and my memory was that we said we would say that you may lose the hours, not just eliminate that if you don't report those changes within 45 days that you may, the hours may not count. Does anybody else, am I misremembering that? I mean, we tossed around a lot of different possibilities. So
I'm sorry, my understanding was that we would strike it in the reg, but that on the training plan themselves, it still has that if you don't turn in your changes for approval, then your hours may not count, because if the changes aren't accepted, then those hours wouldn't count.
Okay, all right.
If I'm wrong, I would be happy.
I think you're right, Leslie. And I think we were trying to avoid also a situation where you would have to have a lot of discretion and or maybe even come back to the board. But so we landed on the advising the licensee at the time. That was my recollection. But we did have a lot of conversation about it.
Yeah.
Any other question or comments? Go ahead, Dave.
I'd say the thing to highlight here too, because I know people might look at this and say, oh, well, now the hours will just count. You're striking this just to say that they won't count. The idea is to strike the language that said they specifically would be struck by failing to meet that 45-day requirement. So this language being taken out, it is still a requirement in statute for you to submit a change within 45 days. The issue is not that the hours could possibly be struck, it's that there's no mandatory language for the board to have to strike those hours. And so if they would still meet what the regulations would approve for those hours, then the only thing now would be that the BSRB staff would have to look at those at the end of the process. And if they would meet, then that would be okay. We could approve them at that time. The only issue might be a little bit of a delay because we could have approved them earlier if we would have known about that change. However, if something is not under those, then the board still does have some authority to strike those hours because they're not in alignment. There's just no mandatory striking of the hours because of that 45-day rule.
But essentially no consequence for if the hours would count. Otherwise, there no consequence for not informing the board of a change in 45 days.
No, the only real issue there would be probably the time it takes to review those hours. And that probably would happen when someone applied for licensure. And so it would take a little longer for those people because the hours would need to be reviewed at the tail end versus earlier on.
Well, does anyone want to make a motion that we go ahead and approve the language for each of the regulations presented? Or for all, I should say.
I will go ahead and make the motion. So looking for a second.
Dave did it. Dave got you on the second. So all those in favor, please say aye.
Aye.
Aye. Any opposed, same sign. Great. Thank you very much, Leslie, for getting that put together for us.
Thank you.
And Mary, on the next two items under old business, follow-up from the board's out-of-town planning meeting, there was discussion about supervision by practitioners from different professions for the marriage and family therapy and professional counseling professions. There was further discussion by the board on that point. I think before making a formal change, the board wanted to allow the professional counseling advisory committee some more time to discuss that point. And so that is being referred back to the advisory committee, and it has not met since that October 23rd meeting. So just kind of wanted to keep that item on the radar, but ultimately it'll be something probably with additional discussion for the board at the January meeting.
Great. Yes.
And then the last item, possible change to the minimum length of time for supervised practice required to obtain a clinical license. We have had discussion about previously there was a 4,000 hour requirement with a minimum length of 2 years to accrue those hours. And then when the time period changed from 4,000 hours down to 3,000 hours, there was no adjustment to the minimum to lower it proportionally, which, you know, logically, if you follow that, if it's 4,000 hours and no less than 2 years, the question should be asked, should it be 3,000 hours and no less than 18 months? Because that would follow proportionally. One of the issues right now is that there was a change to federal legislation concerning upcoming Medicare reimbursements for certain individuals who are clinical marriage and family therapists and clinical professional counselors. That is scheduled to begin, I believe, as of January 1st of 2024. And one of the concerns there is that that change to federal law defines marriage and family therapists and professional counselors. And in the definition in the federal law, it basically says those individuals have postgraduate experience not less than 24 months or 2 years, I forget. But the concern would be that if you lowered that, would our definition no longer meet what federal law would allow for the reimbursement, prohibiting that group of individuals from qualifying for reimbursement. So I had reached out to representatives from KDHE and KDAD because we don't usually handle reimbursements, but since we can affect those definitions, we do have a role in part of this process. And I was advised that they sent back a message that was very thoughtful, which I appreciated. But representatives from KDHE said they recognize that the board does have independent authority on this matter, but they are currently working through this issue. And at this time, they would appreciate if the board could basically pause consideration of changes right now to ensure that there's not an inadvertent issue and disqualifying people potentially from those reimbursements. So they just said that they would prefer if the board could just pause this issue to revisit in the future. And so that's what the board had ultimately decided at the October 23rd meeting. Not that it would never be revisited again, but at least right now to pause.
Yeah, great. Thank you. I think that makes good sense right now for sure. So we'll move on into the new business items and consideration of recommendations from advisory committees.
Yes, and so basically when you look at the advisory committee policy for the board, one of the items that is spoken to in that advisory committee policy is what happens when recommendations are forwarded to the advisory committees and vice versa when they're forwarded to the board. And so the advisory committees meet frequently and discuss recommendations. And basically, I think what I will be doing going into the future is trying to put more of an item on the agenda specifically for recommendations the advisory committees would like forwarded back to the board. So that way we could highlight those a little bit cleaner. And so for this meeting, there is a couple that I wanted to reference. One of those is from the Social Work Advisory Committee. We have mentioned before that there is a multi-state compact draft language that has been finalized for the social work profession. And the Social Work Advisory Committee has received information from the drafters of that compact. Some of those individuals were from the Council for State Government. They have attended advisory committee meetings for social work, answered questions. I mentioned that Kansas NASW had contacted me indicating that they were in favor of the compact being introduced in Kansas too and requesting the board be supportive of that. The most recent Social Work Advisory Committee meeting, the Social Work Advisory Committee made a recommendation to forward to the board that if legislation were to be introduced, they would recommend that the board be in favor of the Social Work Compact. And so I wanted to make sure that that recommendation was forwarded back to you. Just for reference, last year, the Kansas Counseling Association had approached the Counseling Advisory Committee and had requested support for the counseling multi-state compact if that would be introduced in legislation. And what happened last year was that was brought to the board at the October or November board meeting. The board was given the opportunity to research that compact further and then decide if they wanted to take a position on that at the January board meeting. So that is something that you could do if you would prefer to do it that way for uniformity, but it would also allow you some time to do some independent research on the social work compact between now and the January meeting if you would like to do so. One item that we have talked about a little bit is the professional counseling compact is set up to where individuals will need to apply for a privilege to practice in different states. And when they do that, there will be an independent cost that they will pay based on the privilege to practice in those states. The social work multi-state compact is set up to where it will replace some of the traditional licensure. And so rather than do a privilege to practice model, it would allow for states to begin to issue multi-state licenses. And so when that occurs, basically, if you live in Kansas and you want to practice in both Kansas and Missouri, you would now be able to get a multi-state license from the state of Kansas. Alternatively, if you live in, let's say, Oklahoma, and you currently have a license in Oklahoma, Kansas, Missouri, now you would be able to get one multi-state license in your home state and no longer have to get licenses in other states. So the question on this to consider is that if the legislation should pass, probably one of the things to be figured out would be what amount would you like to set the multi-state license amount at to make up for all of the lost revenue from licensees outside of the state that are no longer going to be obtaining the Kansas license. However, there will logically be some people in Kansas that would be interested in practicing in other states. And so the idea would be that you lose the license revenue from those outside of Kansas, you make up for it by the multi-state license being higher than the traditional in-state license. So just something to think about. We are trying to do a survey to social workers here in Kansas to see how many of them would be interested in a multi-state license, to get an idea of maybe the price point to set that multi-state license fee at if the legislation passes. But the question for you is between now and the January meeting, if it would be your favor, maybe take the time between now and January to decide if you would be supportive of the compact if it's introduced in January during the session. And Cynthia and Andrea, if you have any further comments about that recommendation for the board, I want to give you the opportunity to if you want to share any additional information.
We had, I think, we had a presentation from, I think twice from the multi-state compact designers. And I think both Andrea and I won't speak for Andrea, but we did feel like it was something that would be very beneficial, even just for telehealth. I know, I had an inquiry to treat someone in another state, and I wasn't licensed in that state at this point, so I had to decline that referral. I think it would be very useful for social workers.
Okay. Well, it does say that the board, when it receives a recommendation, you can either take action on it, you can decide do something different with it, or you can pause and kind of study. And so if there's not further direction, would it be okay with all of you to take the time between now and January to research it further?
Yeah, that sounds good. Since we have a little time anyway, it gives us a little bit more opportunity to explore.
Okay. The next recommendation I wanted to highlight, so for the Counseling Association, or sorry, the PhD level psychologist, the Association of State and Provincial Psychology Boards utilizes something called a CPQ, a Certificate of Professional Qualification in Psychology. And the advisory committee has recently discussed this. One of the items that came up, the CPQ does, that basically is a way of tracking and having quick access to verify that you have met certain requirements for licensure so that jurisdictions can recognize this in a more quick fashion. In terms of jurisdictions that participate, it's a little different because ASPPB also recognizes Canadian jurisdictions. But basically, by my count, there are about 32 states in the United States that currently accept the CPQ for psychologists. And then there's another 11 that recognize some of the requirements of the CPQ, maybe not all. And then there's 2 others that are in the process of accepting those. And by my count, that comes up to about 45 states that currently recognize or are in the process of recognizing some of that, which leaves Kansas as one of 5 states that currently doesn't. And so we brought it up to the advisory committee to see if this would be something you would want to recommend that maybe the BSRB is supportive of. And so I wanted to relay that information to you in terms of that CPQ. And Richard, did you have anything else you wanted to share in terms of the CPQ?
No, except that the discussion, as I remember it, committee members were overwhelmingly, I think, in favor of adopting the CPQ here in Kansas. So it's we had a lot of support around the prospect of doing this.
So if you want to also look at this between now and the January meeting, feel free to go ahead and take a look at that. There was also a presentation by the group that Richard mentioned earlier, PC-SAS, as possibly another accrediting body that could be added for psychology. So I think that item will be revisited as well. So if you want to research that further with PC-SAS, that could be a good item to be looking into as well. And then the last recommendation I wanted to go ahead and have forwarded now is for the Behavior Analyst Advisory Committee. And this item may have already been taken care of, but I believe at the August meeting, perhaps, with that advisory committee, there was a recommendation. Ultimately, they would like the board's support on some language being changed for a statute to identify what certain individuals would be able to provide certain services. And in that statute, it did not include behavior analysts under the initial proposed draft. But I think that there was still some discussions taking place. And since that time, the advisory committee became aware that the new language does include behavior analysts. So I think that item may have already been addressed, but in case it wasn't fully addressed, I wanted to go ahead and communicate that back to the board. And then Linda, if you wanted to add anything else on that item, feel free.
Yeah, that was the children's behavioral specialist service that I talked about earlier, because it talked about the training requirements for the person which was very behavioral in nature, and it was to address the behavioral needs of children in home, which is something that behavior analysts are currently doing throughout the state of Kansas. And so there was a lot of advocacy on that. And the state came back and amended the language and added behavior analysts as qualified as a licensed mental health professional, LMHP, for that service. Okay. So I think it's been resolved.
And I know that there have been some smaller recommendations, some of those involving the unprofessional conduct, some involving things like changes to CEs, but I think we'll just kind of continue to collect those and then bring them all to the board when they're all ready to come from the advisory committee. So I think that is all the recommendations to this point, but I just kind of wanted to bring them forward, and we'll continue to do that at meetings so that you have a clearer idea of the recommendations coming forward.
Hey, David, I like that idea because then what we can do in our different subcommittees or advisory committees is we can also add that in our agenda at the end, like what recommendations would we like to be brought to the full board? I think that keeps it clean. That's a good idea.
Well, thank you. And Mary, would you like me to go ahead and
Yeah,
on?
I was just saying, I was just unmuting, so you could go ahead and do that.
Great. Well, so the first item for new business, this is something that I just kind of wanted to bring up, and I imagine that this will probably be something that we won't be able to decide today, but it is something that I need you all to put some thought towards. In your packet of material, I included a copy of KSA 74-7511, and this is a statute that was passed back in 2016. It is fingerprinting of applicants to practice professions regulated by the board, procedure, and collection and disposition of fees. And what this basically does, this statute says that part of an original application or for reinstatement of any license, registration, permit, or certificate, or in connection with any investigation of any license holder, registration, permit, or certificate, the BSRB may require a person to be fingerprinted and submit to the state a national criminal history record check. And then there's some more details about that. It talks about the fees collected. From what I have been able to determine, this passed back in 2016, but then after it passed, authorizing the BSRB the ability to do background checks by fingerprints, it did not move forward. So there's not a current requirement for the BSRB licensees. However, starting a couple of years ago, with the passage of multi-state compacts, one of the requirements for those compacts has been a common element that requires background checks by fingerprinting. And the question now for the board to consider is, so we have on your agenda, you can see three of them that I have listed: the SIPAC compact, professional counseling compact, and then just to be proactive, I thought I would reference the languages in the social work compact. And essentially what the SIPAC compact says is that basically one of the requirements to allow individuals to get a privilege to practice under SIPAC is that the home state licenses authorizes a psychologist to practice in a receiving state under the authority of telepsychology. There's also a section that talks about in-state practice, but it says that the state must require an identity history summary of all applicants at initial licensure, including the use of the results of the fingerprints or other biometric data check compliance with the requirements of the Federal Bureau of Investigation or other designee with similar authority not later than 10 years after activation of the compact. So for SIPAC, it basically says we would need to require this for a psychologist, but we have 10 years to put it in place. And SIPAC became effective in Kansas January 1st, 2022. So we have quite a few years, but eventually this is probably something that we'll need to be putting in place for licensed psychologists, basically at least in the next 10 years to make sure we're still in alignment with the compact. For professional counselors, it says that a member state shall implement or utilize procedures for considering the criminal records history of applicants for an initial privilege to practice. These procedures shall include submission of fingerprints or other biometric-based information by applicants for the purpose of obtaining an applicant's criminal history record, information from the Federal Bureau of Investigation, the agency responsible for obtaining the state's criminal record. And basically, it also says here they'll have to implement that by rule in the time period established by the commission. They have not established the time period, but essentially for individuals who can practice under the compact, we will need to have a requirement in place. And as a reminder, this compact only relates to the clinical level of professional counselors. So it would only be those LCPCs, but to practice under that, we would need to have made sure they have a requirement for a background check as a requirement of licensure. And then for the social work compact is for bachelor's level, master's level, and clinical level. And the requirement there is similar. States will have to implement procedures to consider the criminal history of applicants for a multi-state license. Such procedures include fingerprints, biometrics, et cetera, et cetera. But for the social work, it really says for the individuals getting a multi-state license. So potentially you would not have to require it of people who do the in-state single state license, but for people who are doing a multi-state license, you would need to require the background checks by fingerprint. And so the reason I bring this up, when that passed in 2016 and didn't move forward, it just authorizes the board to have the authority to do that. And with these ones compacts that do require it, I reached out to representatives from KBI to say, okay, if the board did want to implement this for the professional counselors that can practice under the compact or the psychologist, what would we need to do to get this in place? And they basically informed me that there is something that takes about a year to put together, and there's a unique identifier per agencies that would be doing this. But they said when we had passed this, we actually had that set up. So it is set up and ready to go. So that year-long delay would not really apply to the board. But I do not have a good answer yet on the fee that it would cost someone to have the background check. Potentially, this would not even be something that we would receive. Potentially, this would be something that would be a pass-through where they could do something like this with Highway Patrol or another entity that could do the scanning of the background checks, and we would just get the report. But I did want to bring it to you so you could think about how widely you might want to implement this, whether this is something appropriate for all licensees, if it's something just to look at for the individuals under the multi-state compacts. I think it is something to give some thought to, and then I will continue to look and see if I can find out how much it will cost, because that could be part of your decision as well, but maybe something for the January meeting to discuss.
Just throw it out there, Missouri requires fingerprints for behavior analysts. I don't know if they do for any of their other professions. And it's incumbent upon the applicant to pay the cost.
If I remember to that point, Linda, I think that Missouri requires fingerprints for psychologists, and the psychologists have to incur the cost of the fingerprinting.
I can give a little bit of background on that. When the board decided they wanted to move forward with fingerprint checking, they were also in the process of lowering the fees, and they felt that if they lowered the application fee, that would offset the cost to the applicant, so that then the applicant could pay the fee for the fingerprint check. And then when we finally got the fees lowered and stuff, then COVID hit, and so here we are.
Well, if you would like to see the exact language from those compacts, just let me know. The compacts, each one is somewhat lengthy, but if you'd like me to provide that language so you can see exactly what the compacts require, I'd be happy to forward that. But it is kind of a bigger question. You know, do you want to do this just for the individuals under the compacts, or do you want to do this more broadly for all licensees?
But we do, it would be an option to only require that for people, for all three of the professions that we're talking about. So the existing language does not require that our Kansas licensed psychologists have a fingerprint check. It just, if they want a multi-state.
For social work, that's kind of how it's worded. It says that we would have to implement procedures for considering criminal history records of applicants for a multi-state license. And so based on this language here, at least for social work, based on the way that I'm reading it, it does not look like it would need to be required for all licensees, just ones that would want to be practicing under the compact with a multi-state license.
But the other two professions, the language requires that all psychologists be fingerprint checked if they're licensed in Kansas.
So I'll have to
within
look
10 years.
A little bit closer, but the language basically talks about individuals practicing under the compact, and then it says it would have to require as a condition of initial licensure. So I think for them to be eligible, it would need to include all licensees, but it may not come into play until the individuals want to practice under the compact. So I can clarify that a little bit more. I'll have some discussions to see if that's just for people, if they could potentially opt into it if they want to do under the compact, or if it would be a requirement of the state that we would need to do it for that class of licensees. That is a good question. Jim, you had a question? Your hand was raised.
Yeah, my question really is for our legal counsel. He looks like he's fallen asleep, and I got something for you, Tim. Since this is a regulation now, and we can do it in the age of, let's just say, people losing their identity or somebody stealing their identity, would we have any increased accountability if something were to happen to someone we licensed and we didn't follow this process? In other words, someone comes back and says, you had this since 2016 and you, as a board, failed to do it. Or in that case, the state also failed to follow up on it. I don't know that you can formulate an opinion today, but maybe for next time. I'm just curious what our responsibility is to respond to this.
Yeah, I could see the argument being made. I don't know there'd be a whole lot of exposure. But I think as a matter of policy, it's definitely something to think through as well. But I can give some additional thought to that issue, Jim.
Thank you.
So yeah, I just want to bring this to your attention. I've talked to maybe a couple times before about the requirement for SIPAC, but given that 10-year amount of time to put it in place, we have quite a bit of time. At this moment, I don't know what the time period is for the professional counseling because they haven't established that. And with the social work, that would still depend upon that bill passing, the infrastructure to be determined, but eventually these are three groups that will need to have something in place. So.
Well, another good topic for us to think about and discuss as we move forward into these other arenas. So thanks for bringing that information up. And it would be good to have some other opinions about what background checks and things like that would look like.
Hey, real quick, Madam Chair, Dave, Leslie, have you been in discussion with the KBI about the bill that they're proposing this next legislative session?
Yes, I did talk with them about that too. There was one they were working on last year, but it never really came forward. Basically, they are trying to make some of this a little bit more uniform because some of the legislation that has been enacted over the years for fingerprints did not include all the necessary requirements. And so, however, they said that they reviewed our statute and they said that it was good. And so they basically said they didn't think we would need to be included in stuff like that. And it might be helpful for us if we were not, just to, they kind of reminded me with what we have heard from other people that once you open a statute, you don't know how they're going to change things. But they said, based on the elements they look for, they said what they see in our statute is pretty good. And so they don't think there would need to be further changes. The only question I had was when I look at our overall statute for the multi-state or for the background checks, there is language at the very beginning of that says as a condition of initial licensure, or it talks about for disciplinary purposes. And I think the majority of people who might be affected by this are people who are already licensed. And so I think you could look at it for initial licensure for, like, let's say the social work. That makes total sense. Initial licensure with a multi-state license, that would apply. But for the other two, since they're already licensed, the question would be, is initial licensure the same as getting a privilege to practice under the compact? And that potentially is something that we could define in regulation to clarify any question about that. But yeah, to your more direct point, I'm aware of that legislation, but they basically said for what we need, they think we're already pretty much good to go.
So Dave, I'm looking at the agenda and I want to be sensitive to time since we're about 20 till. I don't know if you feel like you can get through one or two of the other topics. I just want to make sure that we reserve time for the executive session. And I don't think we need more than 10 minutes, but I do want to make sure that we have that completed on the agenda today.
Okay. Yeah, I think D and E, we will not need a very much discussion about. C, I think we can go ahead and handle here pretty briefly, hopefully. But I can just bring that up and then potentially we could defer D and E to the next board meeting. So
Sounds good.
then I'll go ahead and share my screen here. Basically, with the passage of Senate Bill 131, we referenced that there are some new license types. And one of those new license types is the student temporary addiction counselor licenses. For reference, if you look at the bill, it is section 23. That's a fairly long section. So we're really looking at new language in sections G to I. And to kind of frame this, when someone applies for a new student addiction counselor license, this is a brand new license, so we're just trying to figure this out. And the information we put into the statute was put in to try to make sure that we could move forward on these licenses without having to clear up a lot of things in regulations. So what it says here is a person may apply to the board for student temporary addiction counselor license, but they have to provide certain information. And the first thing is providing documentation of at least 60 credit hours from an institution of higher education with an emphasis in addiction counseling or a related field as defined by the board on rules and regulations. And related field is defined in our regs right now. 2, they would have to provide a signed attestation indicating the applicant's intention to pursue licensure as a licensed addiction counselor with a plan to complete the education requirements towards a licensed addiction counseling license in 48 months. And then 3, providing an education plan signed by an official of the institution of higher education, including steps to obtain coursework necessary to receive an addiction counselor license. So that is the main language I wanted to highlight for you before we started this discussion. But basically, we have had some applicants apply for a license who have had coursework that was more in the area of social work than specifically addiction counseling. And in the regulations for addiction counseling, a related field does include social work. So for item 1 there, 60 credit hours from an institution of higher education with an emphasis in addiction counseling or a related field, well, those social work classes would qualify as a related field defined by the board and rules and regulations. So, so that is something that would qualify. Under number 2, the signed attestation that the applicant's intention to pursue licensure as a licensed addiction counselor with the plan to complete the education requirements towards a licensed addiction counselor license within 48 months. And then 3, provide an education plan signed by the official of the institution of higher education, including steps to obtain coursework necessary to receive an addiction counselor license. What some others people have argued in submitting an application is that they are pursuing a degree in social work, not addiction counseling, but a social work degree. And what they hope to do is after they graduate, they hope to take the examination to become a bachelor's level social worker. And then if you become a bachelor's level social worker by passing the examination, there is a method by which you can use that license as satisfying the educational requirements to test for an addiction counseling license. And so what they have argued is that taking the classes for social work and pursuing the social work license is basically their method to obtain the addiction counseling license. And so I wanted to bring this to you because in our reading of this language, the social work classes do not appear, I mean, while they are in a related field, they do not appear to be classes towards an addiction counseling license. It appears to be classes towards a social work license, and then they plan to use that social work license to become an addiction counselor, but it does not seem to be a direct connection. And so while I see what they are saying, it does not seem, when you read the language here in the statute, it does not seem to match what is written here in the statute. But I wanted to bring it to you. This is the first time that we're working through some of these issues. So I wanted to kind of let you ask some questions or see what you thought as board members, if this kind of matches. And Leslie, you're the one who's been reviewing these applications with staff. Do you have any other comments to add to that point?
No, it's that, yeah, and it could happen with any profession, because if you're going to get an LPC, then you can test and become an LAC, or an LMAC. So any profession could do it. It just, yeah, depends on how the board sees the education they're completing.
Is there no course, I'm not remembering if there was specific coursework requirement for the addictions counselor license in addition to passing the exam, or can you just test out with if you have a requisite bachelor's degree in some related field?
So for the social work, if you have an LBSW, there is specific coursework, and they have shown that they have that or are going to obtain that. That is required before you can test for an addiction counselor license. For all the master's level and clinical level, there is no coursework requirement. They just test out.
But this license, this temporary student license only applies at the somebody seeking a bachelor's, correct?
Well, I mean, it doesn't specifically say they have to get a bachelor's degree, but they have to have at least 60 credit hours. So if they're in a master's degree, they could do the same thing.
Well, if you have 60 credit hours, and for a lot of master's programs, you're done. So you wouldn't have a temporary student. You wouldn't apply for a temporary student license if you were in a master's program, most likely. Or have you had anybody?
Yeah, we have.
Oh, really?
So,
okay.
So they have to have at least 60 credit hours so they can be in their master's program and have the 60 hours and not be done with their master's program and apply for the LAC.
Okay.
So we realize Senate Bill 131 included a lot of items. And for some of these, this is our first time working through the language. I believe the intention was to have people that are really focused on becoming addiction counselors, but we also want to be fair to the plain reading of the language. If there were things that were unintended, but the language allows, that's something different. But in reading at least from our perspective, the plain reading of items 1, 2, and 3, even though the coursework would count as a related field, seems like the classes would still need to be in furtherance of an addiction counseling license. So that was kind of how we were looking at it. But since we wanted to bring this to the board to see if you agree with that, or if it's your preference that we should interpret this for the purpose of being uniform and consistent with everybody, what your thoughts are on that.
Well, if the intention is to make a path for more people to become addictions counselors, it seems to me, since you can become an addictions counselor with a bachelor's in a related field, you still have to pass the exam and show that you have that level of knowledge, which probably means you will have taken some coursework or else studied a lot. It seems like it serves the purpose to allow people with a bachelor's that meet the plain language here to get the temporary license.
My discomfort has always been that line that says, from an institution of higher education with an emphasis in addiction counseling or a related field. Because if it was, you were doing this for people who were in an addiction counseling program, that would be one thing. It would be clear that that's where their training was going to be focused. But once it said or a related field, you get these people who are now trying to pursue a degree in social work or psychology or something else, and also trying to kind of figure out how to get this also. Because of that, what else, Dave, is defined as a related field besides social work?
Leslie might be able to do this better off the top of her head, but I think there are 6 different areas, I think.
I think it's all the professions. Hold on. I'll look real quick. Related field: criminal justice, counseling, healing arts, human development and family studies, human services, marriage and family therapy, nursing, psychology, social work, or theology.
Well, an issue that you may face is, if you look at G2 and G3, what's the education requirements? What's the coursework necessary to receive the license? I would argue you look at G1 and it says an emphasis in addiction counseling or a related field. And that modifies what's in G2 and G3. And so then if somebody obtains education in a related field, which is acceptable by rules and regs promulgated by the board, how could you exclude them under G2 and G3? I mean, I think that would be the issue you would face if it ever came up.
So the difference, and I'm just asking the question. So a social work, you can have a social work degree, but you can only get an addiction counselor license if you have a social work license by testing out. You can't just have a social work degree. If you don't have a license by the board as a social worker, then you have to do the required coursework for an addiction counseling license. So a social worker can't get a license, the social work degree can't get a license until they have a social work license, unless they have all the coursework. Does that matter?
I think the discussions I remember about this level of licensure, I think it may have been worded that way partly because there aren't very many programs in addiction counseling yet.
Correct.
We expect there to be more, but this was intended to allow people to have a related education, and there's some foundational pieces that would be part of a formal addictions counseling program that would also be parts of most of these other professional degrees, but that it would allow them to, it says that they have to have a specific plan to obtain the necessary coursework if in fact they're going to have to take the coursework. And so, I mean, theoretically, even somebody who was in an addictions counseling program, they could state their intention and have a letter from and not end up following through with it. Mm-hmm. So, it's a kind of loose parameters in that way, but I'm gonna want to move towards making it possible for more people to obtain this degree or attain this license, because that was the intention in the first place, I think.
So I think we're having some good discussion and things we need to talk about. And I'm also, again, being sensitive to time. And I don't know if we want to continue this discussion later, Dave. It sounds like we have some things to talk about a little bit more on the interpretation and how we see this. But I do really want to get to the other agenda item, and then we definitely have to talk about the meeting date for the next board meeting.
We also, though, do have applications. So can we bring the applications to CAPA for further discussion?
That seems appropriate.
Okay.
Okay. Well, the next item then would be the executive session. And I do have a motion drafted here. Basically, I could read off this language and then ask if a board member wanted to make this motion. The question would be, how long do you want the executive session to last?
My question for the board is, do we have a hard stop? Because I think if we have a hard stop, we need to make it about a 4-minute discussion, which I think we can do as long as there's not a lot of questions or comments on that. Does anyone have a hard stop at 1? Could we? Okay. A couple of people maybe. So let's try to make this as quick as we can.
Okay. Well, here is the motion. It says, pursuant to KSA 75-4319, does the board member move that the board recess into an executive session for 5 minutes to reconvene the open meeting at 1 p.m. The meeting will be reconvened remotely by conference call at 1-877-278-8686, pin 327-072, and by Zoom as directed in the notice of meeting that was sent to individuals who requested notice and is published on the board's website, ksbsrb.kansas.gov. The justification for closure is to discuss personnel matters of non-elected personnel. The board's legal counsel, Tim Resner, is to be included in the executive session. The subject to be discussed at the executive session is annual performance evaluation for the executive director. Is there a motion by a board member to make that motion?
So moved.
Thank you, Jim.
And was there a second on it?
Yeah, I think Cynthia had that second, and all those in favor, aye.
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 Okay, Dave, we'll do just like we did the break. He'll move us into the waiting room. Please refer to the email that was sent to you at 9:07 for the phone number. Please log in now. We'll see you soon. Okay, it looks like we're all back in the meeting. Thank you very much. For the record, the board has agreed upon a time frame and a process for David's performance review, which will be conducted following the January board meeting. Okay, the next item of business we need to tackle is the January board meeting date. There is a potential there is a conflict for several of us for the January meeting because there is another association for counseling. I probably have that wrong. I should have that handy, but there's another conference that several of us will be attending. And so we have some recommendations for moving the January board meeting. We didn't want to move it January 15th because of the holiday. So we were looking at potentially January 11th or 12th. Is that correct?
Yes, that is correct. Thursday, January 11th or Friday, January 12th.
Is there a preference by this group?
I'd prefer Friday, but I could do Thursday.
And I won't be available either of those days.
Friday, the 12th works for me.
Friday, the 12th would work for me, except 9 to 10.
So if we started the meeting at 10, you're available?
Correct.
Okay.
Either's fine for me.
I can do either.
Yeah.
So I'm only hearing that there's one person who cannot do the 12th. Is that correct? That's probably about as good as we're going to get, David.
Okay. Well, let's plan on that Friday, January 12th. I will move the calendar appointment that you may have already had out there, but if there's not one, I'll put it on Friday, January 12th, just a normal time from 10 a.m. to 1 p.m. And that should be a hybrid meeting, so we'll have the ability for you to attend remotely or in person at the BSRB office.
Okay, great. Thank you very much.
And Mary, it's not on the agenda, but I thought I would just add one item. The CAPA meeting in December is currently scheduled for the day after Christmas, December 26th. And so I wanted to propose to the board, just as long as it was okay with all of you, to move that 1 week earlier. So it would be on Tuesday, December 19th, be the same time, but I think that might avoid some conflicts if you have things like that.
That's fine.
Yeah, sounds
Thank
like a
you.
good move. All right, I would like to thank all the board for staying a few minutes after so we could finish the business. The other items will carry over into the January meeting. If there's no other business, I'll take a motion to adjourn.
So moved.
Second.
Thank you, thank you, Donna. All those in favor, please say aye.
Aye.
Thank you all so much. Have a great day.
Thanks, everyone.